I'm Dr. Justin Braverman. I'm the Director of Bariatric Surgery at PIH Health. Bariatric surgery is surgical weight loss, so I do procedures to help obese patients permanently lose weight. There's many factors that go into making a patient gain excess weight, significant weight, specifically hundreds or more of pounds. So it's lifestyle, it's genetics, it's eating behaviors, sometimes it's psychologic, but it doesn't quite matter the reason for obesity. The treatment's typically the same. If you have a body mass index above 30, by definition that's clinically obese and you may be a candidate for a weight loss operation. So when you tell an obese man or woman to go diet and exercise, you're giving them about a 1 in 1,000 chance to get to a normal weight. With surgery, success rates are about 75%. So surgery just blows medical weight loss out of the water. All my training's from Chicago, which is where I went to undergraduate college at University of Illinois. I attended Chicago Medical School, and when I completed medical school, I went to residency at Mount Sinai Hospital and did a research fellowship at Northwestern. In my surgical residency, I took a year out and spent a year in the field of research of surgical cures for diabetes. I really care about my patients, and I found that in this field, you'd get to know people, and sometimes they'd wait on the transplant list for over a year, never get their organ, and pass away. I didn't like that. I was always very good at laparoscopic surgery, and obviously obesity and diabetes go hand in hand, and so these things kind of pushed me into the field of obesity surgery. It treats what we call comorbidities or associated illnesses, like not just diabetes, but hypertension, high cholesterol, sleep apnea. It improves libido and confidence. It's a procedure or procedures that essentially dramatically improve quality of life. And as a physician, that's extremely rewarding, where I get to do one operation that cures 20 problems, gives patients a second chance at life, and I get to follow patients long term. I get hugs 3 times a week from patients. It's a rewarding field in that sense that I get to do what I love, and my patients are usually happy and successful, and it changes lives. Not to be lighthearted, nobody needs a gastric bypass at midnight. So I get to be home with my family, I get a lot of time with my children, and it's not banker's hours, but at the same time, it's a comfortable lifestyle as far as emergencies and, work satisfaction. Recently, PIH Health has been able to obtain the designation as a Center of Excellence in Bariatric Surgery. This was a rigorous, thorough, independent review from the American College of Surgeons. A reviewer came into our hospital, looked at all our ancillary services, looked at our equipment, looked at our surgical outcomes and our expertise, the number of cases we have performed to make sure that we not only had a certain level of experience, but a low complication rate, high success rates, and an outstanding personnel here to care for our patients. And if I were sick, this is the place I would go.